Is my first time vlogging. I think that's what it's called. I wanted to start doing this mainly because um, it is less time consuming, and I think a lot of what I write becomes very wordy and lengthy. And I think personally, when it's someone I know, I would rather see them animated. So now that, one second, guys, Danielle, no, shh, everything, shh, shh. I think now, since my husband will be gone for a while, I will start doing this because it will help him too, just to see a little bit of the animation instead of just letters and blogging. So anyway, some of you may know that I've had some health issues for the past few months. You've probably noticed a change in my weight a lot. I was going to keep it under wraps for a while, and then there was a moment where I was absolutely terrified. So I asked about 6 of you to pray for me. I didn't give a whole lot of detail, but enough that you would know that I was a little bit nervous about some test results. And then from there, everything has just kind of spiraled into this crazy, unknown. I'm not so much nervous anymore as I just kind of want an answer. So instead of typing all of that out, and it can get kind of boring, I'll just update you. So back in January, I was really tired of feeling sluggish. A lot of people move here up to upstate New York during the winter and say that they get, the blues because it's not sunny outside. I personally was not feeling that way. I loved the change of pace of weather. The snow was beautiful. The kids and I were really settling into this area. It's beautiful up here. I thought a lot of my weight gain was because I was feeling, when it's cold outside, you bake a lot and make lots of soups and noodles and breads. And anyway, so I thought, well, I should probably cut back on that. I am getting older. My metabolism isn't as great. I don't work out. I try. I don't really enjoy it. Keeping up with the 6 kids, I would say, is a pretty good workout. Lots of lifting, walking fast, climbing stairs, sudden movements. All of that gets my heart rate going quite a bit during the day. Anyway, so January I started experiencing some pain right up in here, just kind of this area radiated around my back. I could compare it to most of my pregnancies when I was later on, like in the 8th and 9th month, I would have what my doctors would tell me was a gallbladder attack. It would last maybe 20 minutes, 45 minutes, enough to like really get your attention, and then it would pass. And if I watched what I ate, then it didn't really give me trouble. Well, it's been 4 years since I have been pregnant, and I was having this pain again. And it was on and off, and then it became pretty consistent. Not unbearable, but enough that it was just annoying. And I thought, there's got to be something going on. So I scheduled an appointment with my doctor, and she had an opening in a couple of weeks. And during that time, I got a urinary tract infection, which also I don't ever hardly get. So I use a great app called Doctor on Demand, and I would highly recommend you look it up. I'll put the link down below. I'm an ambassador for them because that's how often I call them. But anyway, so I called the doctor that I FaceTimed with there. I described my symptoms. I had taken an at-home test. She prescribed me antibiotics. I went right in, I think for that it was 10 days of antibiotics. And then by then it was my appointment with my regular doctor, and we took another urinary test, and it came back that my infection was cleared up. So great. But I'm still having this pain, and it just feels like a heaviness. And I thought, it's kind of where my kidney was. And kind of still wrapped around, so I had a lot of indigestion up here in that V where your diaphragm was. And then I just kind of felt like when I would lean to the side, like I'm just carrying bricks around, just right around here. So I mentioned it to her, and I said, my pain is still at the moderate level, and I don't feel like it's getting better. Instead of on and off, it's more just constant. So she put me down for an ultrasound of my gallbladder, liver, kidney area, and then a barium test for ulcers. I went in for both of those within a couple of days, and that night, the nurse called me and told me that I had 7 masses on my liver that were all about 2 to 4 centimeters in diameter. And of course, that's really, really scary news for someone that had never heard of that being an issue. And so I called my family, and apparently some of my immediate family has had markers like that before, and they ended up to be completely fine. Not 7 of them, but nonetheless, they all ended up to be benign. So the follow-up for that is basically you go in and you get an abdominal MRI. So I did that. I had to wait a week for the results. So during that week, I was doing good at first. And then we're supposed to find out on a Monday. And by Saturday night, Sunday, I was really struggling. I looked at my husband and I said, I really didn't want you to go on this deployment, but I also didn't want cancer. So that was kind of where my mind thought was. And we kind of had our breakdown then, just of not know. I don't do well with the unknown. So anyway, I went into my doctor for the results, and instead of 7 masses, it ended up to be 9 masses, all of which were 4 centimeters in diameter or larger. And then she found out that I had gallbladder sludge. So of course, she right away says, your gallbladder probably needs to be taken out. I had mixed emotions about that because I don't have gallbladder stones, and I didn't have kidney stones. I didn't have ulcers. The masses ended up to be benign. So I'm thinking, this constant pain, it didn't matter what I ate, just didn't seem like it was gallbladder sludge. And so I called. I have a really good friend who's a health coach, and I have another friend who is a chiropractor, and I just talked to them about what their thoughts and opinions were about gallbladder sludge. Can it be reversed? Can it not? Am I just prolonging the inevitable? Do I just need to get it taken out and get it done with? On the flip side, a lot of women my age that are also close friends had theirs removed, and I know of a couple men as well. And they all say it was the best thing they could have done. Their pain ceased right away. So I'm really on the fence about it. In the meantime, she referred me to a gallbladder specialist. I went to see him a week later. By then, sitting in his office, I was in so much pain. As long as I sat down, I was good, but I couldn't walk. And our kids take dance class right down the road, and walking to dance class, I actually had to call my husband, and he went back and got the car to pick me up from dance class because I couldn't walk. Anyway, at the gallbladder specialist, he was reading over the doctor's notes about the MRI, and he said, I don't know why nobody's mentioned it to you, but on here it says that your right kidney is swollen. So I don't know if the camera is reversed or not. This is my right. This is the side of the pain that I am hurting on. And so it makes sense to me that when I lean back in chairs and it hurts right there, that makes sense to me. So he said that it's possible that I could have part of my UTI could still be up in that kidney area, and it could be just irritated enough that it's pinching off where my urine would filter down, and it could be retaining urine and filling up and enlarged because it's enlarged. He said, or I could have like a stone that is blocking it. Even though stones didn't show up on my MRI, it could have been during the days between all of the tests, I could have passed a stone, in between all of those, and that would explain why the pain got worse some days and not others. So he said he knew that my husband and I and the children were leaving. This was a Friday. He knew we were leaving Monday afternoon to go on block leave to see my family for 2 weeks. He did not want me getting on that plane until he knew without a doubt that my kidney was not expanding because of urine, because it's such an easy problem to fix that why not get it fixed really quick? And then I can go on vacation and come back and we can deal with the more serious stuff. But he wanted to lower my discomfort, all while making sure that something urgent wasn't going to happen in a different state. So I was fine with that. He called the urologist in the town next to us, who had no appointments that day or the following Monday morning. So they both decided for me to go to the ER because there's a urologist on call. And so that's what I did. I came home and Chip and I got a sitter, and I went in with no anticipation of any hiccups happening. I was just going in for a CT scan and a possible procedure that would eliminate any, if there was a buildup of urine, it would eliminate all of them. And I was really hoping that I would feel better and that would be it. So I went in, CT scan taken right away. An hour, we waited an hour. And the doctor comes in very matter-of-factly and says, your kidneys are fine, but you have appendicitis and you need to change into this gown and we have the OR ready for you. And then he left, and I didn't have my questions answered. It was just shocking because there's more to that than just, hey, the OR is ready for you. For me, I need to call the sitter, explain to her that you're going to be keeping my kids overnight now. What I didn't pack for that. I didn't. So thank goodness I had my husband with me. He did a lot of that side work as far as like notifying my family, things like that. But then the surgeon was wonderful. He came in and he could see that I was anxious and sat down and was like, he just was cool as a cucumber, made it seem like he had all the time in the world to answer my questions, like this wasn't an urgent thing. He even performed the typical like press on your appendix, and I had no pain there at all. The pain that I had earlier up here was radiating down, but it was not, my siblings both had their appendix removed, and the key symptom for them was you push on it, and when you let up, the pain once you let up is worse than when you push down. None of that for me. He tapped on my heels, didn't hurt. And so I was just really not sure that they knew what they were talking about. So he said, well, I can give you options. We can go ahead and admit you overnight and see if your pain gets worse. But he's like, I'm looking at the pictures of your CT scan and I can tell you that you do need it out. And he said, while I'm in there, I will take pictures. He knew my gallbladder surgeon. And he said, I can take pictures of your other organs for him if that would also help. And so I said, okay, let's just get it done with, because the sooner you rip that Band-Aid off, the sooner it can heal. And I had a lot to do that weekend to prepare for going to visit my family, and my husband and I had planned an overnight date for the very next night, and I did not want to miss any of that. So within half an hour, I was in surgery, and surgery lasted about an hour and 10 minutes, not a big deal. It's typical outpatient surgery, but the time of night that it happened for me, I had to be admitted. So did that. Was discharged later the afternoon the next day, went to my overnight date that Sunday with my husband, came back Monday morning and performed the HIDA scan for my gallbladder doctor, and then came home, and the sitter was so gracious. She'd packed the rest of the bags. Between her and my husband, they had gotten a lot accomplished. A lot that I don't even remember. So I'm unpacking things that I'm thinking, I didn't do this. And of course I didn't do that because I was kind of out of commission that weekend. So anyway, I go back tomorrow to hear the results of my HIDA scan. I also have my follow-up appointment with my urologist and the follow-up appointment to see how after surgery went with my appendix. I feel fine. I probably overdid it a little bit after surgery, and that was just out of sheer, I wanted to go and had a lot of things that I wanted to do. But anyway, so that's where I'm at. So tomorrow I go in and they're going to tell me if I can prolong my gallbladder surgery, because that's it is kind of what I want to do, and I'll explain later in another video about why I'm thinking about doing that. And I think many of you also saw my follow-up pictures about a special diet that I was on. Nope, look at me now. I look the magical, beautiful self that I am. I'm also swollen and nasty again. Because when I had my appendix out and then I went to see my mother, you know my mom. Well, some of you don't, but many of you do. She's a fabulous cook. And my paternal grandmother is also queen of pies and all things great and sugary. And they were nursing me back to health, and there was a bazillion cookies in front of me all of the time. And I said, I'm just going to put my diet on hold for the days that I'm here. And of course, now I'm home and I'm ready to start my diet again tomorrow. I'm working with a friend, and we will tell you all about that, and we can help be an encouragement to those of you that want to join me in that. But anyway, I will tell you all about that in a different video. And overall, I'll tell you how tomorrow goes and if I need to have gallbladder surgery or not. So I hope all of you are doing well. I hope that these video talks or blogs or vlogs or whatever they're called, I'm so not up to date. I hope they work for you, because I'm thinking that this will be the new way of blogging for me. And yeah, I plan to talk about a lot of different things about how homeschooling is, and how deployment works for us. And so if you have any other questions about our life in the military, life as a homeschool family, life as a military spouse, life as a mom of 6, life as a foster parent, any of those things, I'm an open book. So feel free to shoot me questions, and I will possibly cover it in a future video. But until then, I will see you in my next video. Thanks for watching.